Mount Sinai Medical Center was one of New York's most prestigious hospitals. A gleaming tower of glass and steel that rose 47 floors above the Upper East Side. The Washington Cardiac Wing occupied floors 12 through 16, its state-of-the-art facilities funded entirely by Angela's $200 million donation 3 years earlier. The wing was a monument to medical excellence. Robotic surgery suites, advanced imaging equipment, and intensive care units that rivaled anything in the world. Every room was private, every amenity was luxury, and every patient received care that reflected the hospital's reputation as a destination for the wealthy and powerful. Angela's donation hadn't been motivated by prestige or recognition. She had lost her own mother to heart disease when inadequate cardiac care had delayed life-saving treatment. Her foundation's mission was to ensure that no one would die from treatable conditions simply because they couldn't access quality health care. The irony wasn't lost on her as she ran through Mount Sinai's marble lobby at nearly midnight. She was surrounded by monuments to her own generosity, yet she looked like any other desperate family member who had received a middle-of-the-night phone call about a loved one's emergency. The elevator ride to the 15th floor felt eternal. Angela's hands shook as she watched the numbers climb, her mind racing with medical possibilities she understood all too well. Traumatic cardiac arrest, internal bleeding, brain injury. The statistics she had funded research to improve were now personal nightmares. The elevator doors opened onto the Washington Cardiac Wing's pristine corridors. Everything was quiet, sterile, and expensive. At the nurse's station, Angela could see her son's name on the patient board. M. Washington, room 1547, critical. She started toward his room, her heart pounding with fear and hope. She had made it. She was here. She would see her son and somehow will him back to health through sheer maternal determination. But she never made it to room 1547.
Get away from here before I call security. People like you don't belong in this wing. The words hit like a slap as Dr. Patricia Reynolds, head of cardiac services, physically pushed past the crying black woman trying to reach her son's ICU room. She looked at her with pure disgust, completely unaware she was blocking Dr. Angela Washington, the philanthropist whose $200 million built the entire wing, from seeing her dying child. Let me take you back to 11:47 p.m. on a cold Tuesday night at Mount Sinai Medical Center in Manhattan, where assumptions about worth would cost careers and expose the cruel reality of healthcare discrimination when lives hung in the balance. Dr. Angela Washington had built her fortune on saving lives, not taking them. At 48, she was the founder and CEO of the Washington Medical Foundation, one of the largest healthcare philanthropies in the United States. Her foundation had donated over $800 million to hospitals across the country, funding everything from cutting-edge research facilities to free clinics in underserved communities. But all of her success, all of her wealth, all of her influence meant nothing at 11:32 p.m. when her phone rang with the call every parent dreads. Dr. Washington, this is Mount Sinai Medical Center. Your son Marcus has been in a serious car accident. He's in critical condition in our cardiac intensive care unit. You need to come immediately. 22-year-old Marcus Washington was Angela's only child, a pre-med student at Columbia University who volunteered at the same free clinics his mother funded. He was brilliant, compassionate, and destined to follow in his mother's footsteps as a healer. Tonight, he was fighting for his life after a drunk driver had slammed into his car on the FDR Drive. Angela had thrown on the first clothes she could find. jeans, a sweatshirt, and sneakers, and raced through the empty Manhattan streets. She hadn't bothered with makeup, jewelry, or any of the trappings that usually announced her wealth and status. She was just a terrified mother, desperate to reach her child. What Angela didn't expect was that Mount Sinai Medical Center, the hospital where she served on the board of directors, where her donations had funded entire wings, where her name was engraved on buildings, would deny her access to her dying child because of how she looked.
Dr. Patricia Reynolds had been head of cardiac services at Mount Sinai for 8 years. At 52, she was known for her surgical skill, her administrative efficiency, and her unwavering commitment to maintaining the wing's exclusive atmosphere. She had cultivated relationships with Manhattan's wealthiest families, ensuring that Mount Sinai remained their hospital of choice for cardiac care. Dr. Reynolds had built her career on the principle that perception mattered as much as medical expertise. The Washington Cardiac Wing wasn't just a hospital. It was a sanctuary for people who expected privacy, luxury, and insulation from the kinds of people they encountered in public hospitals. When she saw the black woman in jeans and a sweatshirt hurrying down the corridor at midnight, Dr. Reynolds' institutional radar immediately activated. This person didn't belong here. She looked like family from the county hospital, somehow lost and wandering where she had no business being. "Excuse me," Dr. Reynolds called out, her voice sharp with authority. "This is a restricted area." Angela stopped and turned, her face streaked with tears and etched with worry. "I'm here to see my son, Marcus Washington, in room 1547. They called me about his accident." Dr. Reynolds looked Angela up and down with unconcealed disdain. The casual clothes, the lack of jewelry, the obvious emotional distress, everything screamed inappropriate for the Washington Cardiac Wing's refined atmosphere. "Ma'am, visiting hours ended at 9 p.m., and this wing has very strict policies about who can access patient areas." "He's my son," Angela said desperately. "He's in critical condition. I need to see him." "I understand you're upset," Dr. Reynolds replied, with the kind of condescending tone she used for difficult relatives. "Our patients deserve a quiet, controlled environment for their recovery." Angela felt a familiar chill of recognition. She had encountered this attitude before, the polite but firm dismissal that came when people decided you didn't belong in their space. "Please," Angela said, fighting to keep her voice steady. "I just need to see that he's okay. I won't disturb anyone." Dr. Reynolds' expression hardened. "Ma'am, I don't think you understand the caliber of patients we serve here. This isn't the kind of place where family members can just show up at all hours making demands about visiting policies. This is a private wing for private patients. Your son, if he's even really here, can be moved to the county ward where you people belong." The words hit Angela like a physical blow. Even in her worst fears about her son's condition, she had not imagined she would have to fight for the basic right to see him. "He's my child," Angela said, her voice breaking. "He could be dying." "That's not my problem," Dr. Reynolds replied coldly. What happened next would haunt Angela Washington for the rest of her life, not because of the cruelty she experienced, but because of how it revealed the depth of discrimination that existed even in institutions she had supported with her life's work. "Get away from here before I call security. People like you don't belong in this wing." The words were delivered with such venom that they seemed to echo in the sterile corridor. Dr. Reynolds physically pushed past Angela, her disgust obvious and intentional. "People like me," Angela repeated, her voice barely above a whisper. "Yes," Dr. Reynolds said, turning back with a cruel smile. "People who think they can show up here at all hours dressed like they just rolled out of bed, making demands about visiting policies.
This is a private wing for private patients. Your son, if he's even really here, can be moved to the county ward where you people belong." Angela felt the world tilt around her. Her son was dying 50 feet away, and she was being denied access to him because of her appearance and race. The woman blocking her path was standing in a wing that existed only because of Angela's generosity, using that generosity to fund discrimination. "Dr. Reynolds," Angela said, reading the name tag through her tears, "please, I'm begging you, let me see my son." "Security," Dr. Reynolds called out loudly, making sure her voice carried down the corridor. "We have an unauthorized person attempting to access the ICU." The announcement echoed through the wing like a siren. Nurses looked up from their stations, other visitors turned to stare, and the quiet dignity of the cardiac wing was shattered by the spectacle of a black mother being publicly humiliated during the worst night of her life. Two security guards appeared from the elevator bank, walking briskly towards the confrontation. Angela watched them approach with the sick realization that she was about to be physically removed from the hospital while her son fought for his life. "Ma'am, before you escort me anywhere, I need to make a phone call." Angela reached into her purse with trembling hands and pulled out her phone. Dr. Reynolds watched with obvious impatience, clearly expecting this to be some futile attempt to find someone to vouch for her presence. "Sarah, it's Angela," she said into the phone, her voice carrying clearly in the corridor. "I need you to wake up legal and get them on a conference call immediately. We have an emergency at Mount Sinai." Sarah Chen, Angela's executive assistant for 12 years, responded without hesitation despite the late hour. "Angela, what's wrong? Are you all right?" "I'm at Mount Sinai Medical Center. Marcus was in a car accident. He's in critical condition, and they're refusing to let me see him." Dr. Reynolds was beginning to look uncomfortable. The woman she was having removed was speaking with the kind of calm authority that suggested important people took her calls, even at midnight. "Sarah," Angela continued, making sure her voice carried clearly, "I need you to pull all our donation records for Mount Sinai Medical Center. Every contribution, every grant, every funding commitment we've made to this hospital." The security guards had stopped approaching. Something was clearly not right about this situation. "And Sarah, I need you to get Dr. Morrison on the line. Tell him the board chairwoman is being denied access to her dying son by staff in the wing she personally funded." Dr. Reynolds' face had gone pale. Board chairwoman. Angela's phone buzzed with an incoming call. She answered it and put it on speaker. "Angela, this is David Morrison, Chief of Staff. Sarah just filled me in. What the hell is happening down there?" Dr. Morrison's voice was loud enough for everyone in the corridor to hear, and his tone left no doubt about his alarm. "David, I'm standing in the Washington cardiac wing where my son Marcus is in critical condition after a car accident. Dr. Patricia Reynolds just told me that people like me don't belong here and called security to have me removed." There was a long silence on the phone. "She said what?" "She said people like me don't belong in this wing. She physically pushed me away from my son's room and called security." Angela could hear Dr. Morrison's sharp intake of breath. "Dr. Reynolds, are you there?" "Yes, sir," Dr. Reynolds managed to whisper. "Dr. Reynolds, do you know who you're talking to?" Dr. Patricia Reynolds felt her career collapsing in real time as the pieces fell into place. The Washington Cardiac Wing, Dr. Angela Washington, the board chairwoman, the largest donor in the hospital's history. "Dr. Reynolds, Dr. Morrison's voice came through the speaker with deadly calm. "You are speaking to Dr. Angela Washington, founder and CEO of the Washington Medical Foundation, member of our board of directors, and the philanthropist who donated $200 million to build the wing you're standing in." The corridor had gone completely silent. Even the ambient noise of medical equipment seemed to have stopped as everyone absorbed the magnitude of what had just occurred. "Sir, I had no idea," Dr. Reynolds began. "No idea?" Dr. Morrison's voice was rising with each word. "It's your job to know our board members. It's your job to recognize our major donors. And it's sure as hell your job to show basic human decency to a mother trying to see her dying child." Angela watched Dr. Reynolds' face transform from arrogance to horror to desperation. The woman who had been so confident in her authority minutes ago now looked like she might collapse. "Angela," Dr. Morrison continued, "I am personally coming down there right now. Dr. Reynolds, you are suspended from your position effective immediately. Security will escort you from the building." "Dr. Morrison, please, if I could just explain." "There's nothing to explain," Dr. Morrison replied coldly. "You have potentially destroyed relationships that took years to build. You've discriminated against a grieving mother based on her appearance, and you've insulted the woman whose generosity made your career possible." Angela's phone buzzed with another incoming call. "Sarah, patch in legal," she said. "Dr. Washington, this is Rebecca Martinez, General Counsel for the Washington Medical Foundation. We're recording this call. Dr. Reynolds, you've just committed actionable discrimination against our foundation's chairman during a family medical emergency." Dr. Reynolds looked like she might be sick. "Angela," Dr. Morrison added, "I'm in the elevator now. Dr. Reynolds will be gone before I arrive, and you'll have unrestricted access to Marcus immediately. I'm also calling an emergency board meeting for tomorrow morning to address this incident." Within 20 minutes, Dr. Patricia Reynolds was being escorted from Mount Sinai Medical Center by security, carrying a small box of personal items from her office. Her 8-year career as head of cardiac services had ended in disgrace, terminated for cause with no severance package and no letter of recommendation. Dr. Morrison himself had arrived at the Washington Cardiac Wing, still in pajamas under his hastily thrown-on coat, his face flushed with embarrassment and anger. He personally escorted Angela to her son's room, apologizing repeatedly for the unconscionable treatment she had received. Marcus Washington was unconscious but stable, connected to monitors, and surrounded by the kind of advanced medical equipment that her donations had made possible. Angela sat beside his bed, holding his hand and whispering words of encouragement, finally able to be where she belonged, with her child when he needed her most. But even as she focused on Marcus's recovery, her mind was processing the broader implications of what had happened. If she, a board member and major donor, could be treated with such discrimination during a family emergency, what happened to other families who didn't have her resources or influence? The next morning brought a flood of activity. The emergency board meeting Dr. Morrison had called resulted in immediate and comprehensive action. Dr. Reynolds' termination was confirmed unanimously, along with the termination of the 2 security guards who had participated in the incident without questioning its appropriateness. More importantly, the board voted to implement sweeping changes to hospital policies and training programs. Patient advocacy would be strengthened. Discrimination reporting would be simplified and anonymous, and all staff would undergo mandatory sensitivity training with particular focus on emergency situations involving distressed families.
The internal investigation that followed revealed that Dr. Reynolds' behavior wasn't an isolated incident. Patient satisfaction surveys showed consistent complaints about dismissive treatment from staff, particularly toward families from diverse backgrounds
who didn't fit traditional assumptions about wealth and status. Review of security footage from previous months showed patterns of differential treatment based on appearance and perceived economic status. Visiting restrictions were enforced more strictly against minority families. Wait times in emergency situations were longer for patients without obvious markers of wealth. Most damning of all, internal emails and text messages recovered from Dr. Reynolds' hospital accounts revealed systematic bias in how she and her staff categorized and treated patients and families. One message chain from 2 months earlier was particularly revealing. When a Hispanic family had requested extended visiting hours for their critically ill daughter, Dr. Reynolds had texted her staff, "These people always want special treatment. Stick to the rules or they'll never learn their place." Another email showed Dr. Reynolds instructing nurses to be more selective about which families get access to our private lounges and amenities. We need to maintain the appropriate atmosphere for our paying customers. The investigation also revealed that several staff members had tried to raise concerns about discriminatory practices over the years, but their complaints had been dismissed or buried in administrative processes. Dr. Morrison realized that the Washington Cardiac Wing, despite being funded by a foundation dedicated to healthcare equality, had become a symbol of the very exclusion and discrimination that Angela's philanthropy was meant to eliminate. News of the Mount Sinai incident broke 3 days later when a nurse who had witnessed the confrontation contacted a reporter from the New York Post. The story quickly gained national attention, particularly when details of Angela's $200 million donation and board membership became public. "Hospital denies donor access to dying son," read the headline in the New York Times. The story was picked up by CNN, ABC News, and eventually went viral on social media. The contrast between Angela's generosity and the cruel treatment she received sparked outrage across medical and civil rights communities. The story resonated beyond typical discrimination cases because it involved healthcare, a universal concern that crossed all demographic boundaries. Parents everywhere could imagine the horror of being denied access to their child during a medical emergency. Medical professionals began sharing their own stories of witnessing or experiencing discrimination in hospital settings. Patient advocacy groups demanded investigations at other hospitals. Healthcare reform advocates used the incident to highlight broader issues of equity and access in medical care. Dr. Angela Washington found herself reluctantly thrust into the spotlight as a symbol of both philanthropic generosity and the persistent discrimination that wealth couldn't shield her from. She used her platform carefully, focusing not on her personal experience but on the systemic issues it represented. In a powerful interview with Anderson Cooper, she said, "This isn't about me or my donations. This is about every parent who rushes to a hospital in their worst moment and gets judged by their appearance, instead of being treated with the compassion that medical emergencies demand." The interview clip became one of the most shared healthcare-related videos of the year, sparking conversations about bias in medical settings that extended far beyond Mount Sinai. Dr. Morrison understood that Mount Sinai faced a choice. They could treat this as an isolated incident to be managed and forgotten, or they could use it as a catalyst for meaningful change. With Angela's support and guidance, they chose transformation. First, Mount Sinai hired Dr. Michelle Torres as their new Chief of Equity and Inclusion. Dr. Torres, a former surgeon and healthcare policy expert, was given significant authority and resources to identify and eliminate discriminatory practices throughout the hospital system. Second, the hospital implemented comprehensive bias training for all staff, with particular focus on emergency situations involving distressed families. The training wasn't a one-time seminar, but an ongoing program with regular assessments and accountability measures. Third, Mount Sinai established patient advocates specifically trained to assist families during medical emergencies, ensuring that no family would face barriers to accessing their loved ones during critical moments. Fourth, the hospital created anonymous reporting systems for both patients and staff to identify discriminatory treatment with regular reviews and responsive interventions. Fifth, Mount Sinai began actively recruiting diverse staff at all levels, recognizing that representation mattered in creating an inclusive environment for patients and families from all backgrounds. Most importantly, the hospital changed its fundamental approach to patient and family services. Instead of maintaining exclusivity as a marker of quality, Mount Sinai embraced accessibility and compassion as core values that actually enhanced their reputation. Marcus Washington made a full recovery from his injuries, spending 3 weeks in the cardiac intensive care unit before being transferred to a regular room and eventually discharged to complete his healing at home. Throughout his recovery, Angela never left his side, sleeping in the family lounge that had been made available to her after the initial discrimination incident. The nursing staff who cared for Marcus during his recovery were universally professional, compassionate, and skilled. Many of them privately approached Angela to express their shame about the initial incident and their commitment to ensuring it never happened again. Marcus himself became an advocate for healthcare equity after his recovery, using his pre-med education and personal experience to support his mother's foundation work. He often spoke about the irony of being cared for by excellent medical staff in a wing funded by his mother, while that same mother had initially been denied access to him because of prejudice. The doctors and nurses who saved my life were incredible, but the system that almost kept my mother from being with me during the worst night of our lives was broken. Healthcare should be about healing, not about judging who deserves compassion. His perspective as both a patient and the son of a major healthcare philanthropist gave unique insight into how medical institutions could better serve all families during their most vulnerable moments.
2 years after that terrible night in the Washington Cardiac Wing, Mount Sinai Medical Center had become a national model for equitable healthcare delivery. Patient satisfaction scores had reached all-time highs across all demographic groups, and the hospital had attracted talented staff who were drawn to its commitment to inclusive excellence. The Washington Medical Foundation expanded its mission beyond funding medical equipment and research to include programs specifically designed to eliminate healthcare discrimination. Angela established the Compassionate Care Initiative, which provided grants to hospitals willing to undergo comprehensive equity audits and implement meaningful reforms. The initiative became a powerful force for change across the healthcare industry. Hospitals that earned compassionate care certification found themselves attracting both the best medical talent and the most generous philanthropic support. The certification became a mark of distinction that enhanced rather than diminished their prestige. Dr. Patricia Reynolds never worked in healthcare again. Her discrimination lawsuit was settled out of court, with the proceeds funding patient advocacy programs at hospitals serving underserved communities. Her case became a cautionary tale throughout the medical profession about the career-ending consequences of allowing personal prejudices to override professional responsibilities. Dr. Morrison remained as Chief of Staff at Mount Sinai, but he carried with him a permanent reminder of how quickly institutional discrimination could damage relationships that took years to build. He became a vocal advocate for healthcare equity, speaking at medical conferences and working with other hospital administrators to identify and eliminate bias in their institutions. Dr. Torres used her success at Mount Sinai to launch a consulting firm that helped hospitals across the country implement equity and inclusion programs.
Her work demonstrated that compassionate care wasn't just morally right, it was also good business, leading to better patient outcomes, higher satisfaction scores, and stronger community relationships. The Mount Sinai incident created ripple effects that extended far beyond one hospital or one family. Medical schools began incorporating bias training into their curricula, teaching future doctors and nurses to recognize how discrimination could interfere with patient care. Healthcare accreditation organizations started including equity assessments in their evaluation processes, ensuring that hospitals maintained inclusive practices as a condition of their certification. Patient advocacy groups used Angela's story to push for Patient Bill of Rights legislation that specifically protected families' access to loved ones during medical emergencies, regardless of their appearance, economic status, or background. Most importantly, the incident sparked conversations within wealthy philanthropic circles about the responsibility that came with major donations. Angela's experience demonstrated that writing checks wasn't enough. Donors needed to ensure that their contributions actually served the values they intended to support. The Washington Standard became shorthand for philanthropic accountability, the expectation that major donors would monitor how their contributions were used and hold institutions accountable for living up to their stated missions. Angela Washington personally, the incident had been a profound reminder that wealth and influence couldn't shield anyone from discrimination, but they could be powerful tools for creating change when used strategically and persistently. She continued her philanthropic work with a deeper understanding of the need to address not just funding gaps, but cultural barriers that prevented healthcare institutions from serving all patients with dignity and compassion. She also became more intentional about sharing her story, recognizing that her experience could help other families who faced similar discrimination but didn't have her resources to fight back. She established a legal defense fund to support families who experienced healthcare discrimination, ensuring that economic barriers wouldn't prevent them from seeking justice. Her relationship with Mount Sinai evolved from simple donor to active partner in transformation. She served on committees that reviewed policies, participated in staff training programs, and worked directly with Dr. Torres to ensure that changes were meaningful and lasting rather than superficial. Most importantly, she used her platform to advocate for systemic healthcare reform that would make quality medical care accessible to everyone, regardless of their ability to make major donations.
5 years after Marcus's accident, the Washington Medical Foundation had become one of the most influential healthcare philanthropies in the country. But its focus had evolved from simply funding medical advances to ensuring that those advances benefited everyone equitably. Mount Sinai Medical Center had maintained its reputation for medical excellence while becoming a leader in inclusive patient care. The hospital regularly hosted delegations from other medical institutions seeking to learn from their transformation. Marcus Washington had completed medical school and begun his residency in emergency medicine, choosing a specialty where he could ensure that families never experienced what his mother had endured during his own medical crisis. The annual Compassionate Care Awards, established by the Washington Medical Foundation, had become one of the most prestigious recognitions in healthcare, celebrating medical professionals and institutions that demonstrated both clinical excellence and inclusive patient care.
But perhaps the most meaningful change was seen in the countless families who received compassionate, respectful treatment during their medical emergencies, never knowing that their experience had been shaped by a terrible night when discrimination had nearly prevented a mother from reaching her dying child. Angela Washington kept a photo on her desk from Marcus's medical school graduation. Him, in his white coat, standing beside her in the same Washington cardiac wing where she had once been denied access to his bedside. The photo served as a daily reminder of how far they had all come and how much work remained to be done. The words that had started it all: "Get away from here before I call security. People like you don't belong in this wing," had become a powerful catalyst for transformation that extended far beyond one family's crisis. Because in the end, this story isn't just about discrimination in healthcare. It's about the responsibility that comes with influence, the power of turning personal pain into systemic change, and the understanding that true healing involves not just medical treatment, but the compassion and dignity that every patient and family deserves. Dr. Angela Washington could have used her wealth and influence to ensure better treatment for herself and her family while leaving the discriminatory system intact. Instead, she chose the harder path, using her resources to create change that would benefit families who didn't have her advantages. That choice between personal privilege and systemic justice is one that faces anyone who holds power or influence in their community. It's the choice between accepting that this is just how things are and insisting that this is how things should be. The lesson of that terrible night had rippled outward, creating positive change that extended far beyond one hospital or one family. Sometimes the most powerful response to discrimination is not anger or revenge, but the patient, determined work of building systems where everyone receives the compassion and respect that medical emergencies demand. Justice in healthcare, it turned out, wasn't just about punishing those who showed bias. It was about creating environments where bias became impossible, where every family rushing to a hospital in their worst moment could focus on their loved one's healing rather than fighting for the basic right to be present during that healing. And in the gleaming halls of Mount Sinai Medical Center, where photos of diverse families now decorated the walls alongside recognition of medical achievements, that lesson lived on in every nurse who offered comfort, every doctor who provided updates, and every staff member who understood that healing required both medical expertise and human compassion. If this story moved you, remember that healthcare should heal communities, not divide them. Share this story with someone who needs to hear it, and never forget that in medical emergencies, we are all just families hoping for compassion, skill, and the chance to be present for the people we love. Because every parent deserves to be with their child during medical crises. Every family deserves to be treated with dignity during their most vulnerable moments. And every healthcare institution has the power to choose between perpetuating discrimination and creating healing environments where everyone belongs. The choice, as always, is ours to make.